Nursing care of patients with upper respiratory disorders. The upper part of the respiratory system includes the ears, nose, sinuses, mouth, and throat. It also includes the main bronchi. The upper respiratory system is the most commonly affected area in the body. The term upper respiratory infection includes the common cold, sore throats, and flu. Upper respiratory infections are usually caused by a virus, but may also be due to bacteria or other organisms. An upper respiratory infection is rarely serious, but often causes bothersome symptoms. Over 200 viruses can cause upper respiratory infections. The infection is spread when a virus is passed to others by sneezing, coughing, or personal contact by handling objects that were touched by someone with upper respiratory infection. The upper respiratory tract includes the sinuses, nasal passages, pharynx, and larynx. These structures direct the air we breathe from the outside to the trachea and eventually to the lungs for respiration to take place. An upper respiratory tract infection or upper respiratory infection is an infection process of any of the components of the upper airway. RSV causes infection of the lungs and breathing passages and is a major cause of respiratory illness in young children. In adults, it may only produce symptoms of a common cold such as stuffy or runny nose, sore throat, mild headache, cough, fever, and a general feeling of being ill. But in premature babies or kids with diseases that affects the lungs, heart, or immune system, RSV infections can lead to other more serious illnesses. RSV is highly contagious and can be spread through droplets containing the virus when someone coughs or sneezes. It also can live on surfaces such as countertops or doorknobs and on hands and clothing, so can be easily spread when a person touches something contaminated. RSV can spread rapidly through schools and child care centers. Babies often get it when older kids carry the virus home from school and pass it to them. Almost all kids are infected with RSV at least once by the time they're 2 years old. RSV infections often occur in epidemics that last from late fall through early spring. Influenza. The flu is often confused with the common cold, but flu symptoms are usually more severe than the typical sneezing and stuffiness of a cold. After 5 days, fever and other symptoms have gradually disappeared, but a cough and weakness may continue. All symptoms are usually gone within a week or two. However, it's important to treat the flu seriously because it can lead to pneumonia and other life-threatening complications, particularly in infants, senior citizens, and people with long-term health problems. Spread by virus-infected droplets that are coughed or sneezed into the air, the flu is contagious. People infected with the flu are contagious from a day before they feel sick until their symptoms have resolved, usually about 1 week for adults, but can be up to 2 weeks for young kids. Practical ways to prevent the spread of flu: wash the hands thoroughly and frequently, never pick up used tissue, never share cups and eating utensils, stay home from work or school when sick with the flu. Sinusitis is when a patient feels stuffy or congested, waking up with a headache, and noticing swelling around the eyes. Sinusitis can be inconvenient or even painful at times, but usually not severe. The sinuses are the moist air spaces within the bones of the face around the nose. The frontal sinuses are located in the area near the eyebrows. The maxillary sinuses are located inside the cheekbones. The ethmoid sinuses are between the eyes, and the sphenoid sinuses sit behind the ethmoid sinuses. When we're healthy, the sinuses are filled with air, making the facial bones less dense and much lighter in weight. Sinuses play a role in how the voice sounds. Infection with viruses or bacteria, or a combination of both, can result in sinusitis. Generally, someone with a cold also has inflammation of the sinuses. Pharyngitis is one of the most common respiratory tract infections. Pharyngitis usually involves inflammation of the central region of the pharynx, known as the oropharynx. Because the tonsils are attached to the oropharynx, pharyngitis commonly involves tonsillitis. Viruses are the most common cause of pharyngitis. Many different viruses can cause pharyngitis. Tonsils are lymph nodes in the back of the mouth and top of the throat. They normally help to filter out bacteria and other microorganisms to prevent infection in the body. They may become so overwhelmed by bacteria or viral infection that they swell and become inflamed, causing tonsillitis. The infection may also be present in the throat and surrounding areas, causing inflammation of the pharynx. Laryngitis is the inflammation of the larynx. It causes hoarse voice or the complete loss of voice because of irritation to the vocal folds, which is known as the vocal cords. At the top of the windpipe, there's the trachea and the larynx or voice box. Inside the larynx are two bands of muscle called vocal cords. When breathing, the vocal cords are relaxed and open so that air can get into and out of the lungs. But when saying something, these cords come together. Now the air from the lungs has to pass through a smaller space. This causes the vocal cords to vibrate. The sound from these vibrations goes up to the throat and comes out the mouth. Different sounds are made by lengthening or shortening or tensing or relaxing the vocal cords. When talking with a deeper voice, you lengthen and relax these vocal muscles. When talking with a higher pitched voice, then the vocal cords are tightened, which makes them smaller. Although it sounds odd, sometimes the stomach can cause laryngitis. Stomach acid that helps break down the food comes back up the esophagus. The acid can irritate the vocal cords. A hoarse or raspy voice is the main symptom or sign of laryngitis. There may be no voice at all, or maybe just little squeaks come out when trying to talk. Coughing to clear the throat or feel a tickle deep in the throat may be signs of laryngitis. Now this picture, if you look to the left, this is an elderly, malnourished, immunocompromised patient was receiving chemotherapy for lung cancer. He developed thrush in the oral cavity and pharynx. The fungal infection also spread to the larynx. If you note the characteristic chalk-white patches of Candida albicans infection on the ventral surface of the epiglottis. Diphtheria is a bacterial infection that spreads easily and occurs quickly. It mainly affects the nose and throat. Children under 5 and adults over 60 are particularly at risk for contracting the infection. People living in crowded or unclean conditions, those who aren't well nourished, and children and adults who don't have up-to-date immunizations are also at risk. In its early stages, diphtheria can be mistaken for a bad sore throat. A low-grade fever and swollen neck glands are the other early symptoms. The toxin or poison caused by bacteria can lead to a thick coating in the nose, throat, or airway. This coating is usually fuzzy gray or black and can cause breathing problems and difficulty in swallowing. The formation of this coating or membrane in the nose, throat, or airway makes a diphtheria infection different from other more common infections such as strep throat. As the infection progresses, the person may have difficulty breathing or swallowing, complain of double vision, have slurred speech, even show signs of going into shock. In cases that progress beyond a throat infection, diphtheria toxin spreads through the bloodstream and can lead to potentially life-threatening complications that affect other organs of the body, such as the heart and kidneys. The toxin can cause damage to the heart that affects its ability to pump blood or kidneys' ability to clear waste. It can also cause nerve damage and eventually lead into paralysis. Up to 40-50% of those who don't get treated can die. Prevention. Preventing diphtheria depends almost completely on immunizing children. Most cases of diphtheria occur in people who haven't received the vaccine at all or haven't received the entire course. Pertussis is highly contagious. The bacteria spread from person to person through tiny drops of fluid from an infected person's nose or mouth. These may become airborne when the person sneezes, coughs, or laughs. Others then can become infected by inhaling the droplets or getting the drops on their hands and then touching their mouth or nose. Infected people are most contagious during the earliest stages of the illness up to 2 weeks after the cough begins. Antibiotics shorten the period of contagiousness to 5 days following the start of antibiotic therapy. Signs and symptoms. The first symptom of whooping cough are similar to those of a common cold: a runny nose, sneezing, mild cough, low-grade fever. About 1 to 2 weeks, the dry, irritating cough evolves into a coughing spell. During a coughing spell, which can last for more than a minute, the child may turn red or purple. At the end of a spell, the child may make a characteristic whooping sound when breathing in or may vomit. Between spells, the child usually feels well. Adults and adolescents with whooping cough may have milder or atypical symptoms, such as a prolonged cough without the coughing spells or the whoop.